Thanks very much, as I say, for joining us today. I'm delighted to have been asked to chair this session. We've got three fantastic speakers today. Each of them is going to speak from between 5 to 10 minutes first as an introduction, and then we'll open up for discussion. So I'll perhaps introduce our speakers at the time when I ask them to speak, rather than introduce them all at the beginning. So the first speaker today is Professor Doris Schroeder, who's the coordinator of Trust, a collaborative interdisciplinary body which aims to establish equitable research relationships between partners in high-income and low-income settings. She's the director of the Centre for Professional Ethics at UCLan in the UK, where I used to work, and professor of moral philosophy at the School of Law at UCLan Cyprus. Doris has led large international research projects on benefit sharing, responsible research and innovation, and global research ethics, and is the leader author of the Global Code of Conduct for Research in Research Poor Settings. So Doris, over to you.
Thank you very much, Mike. It's a privilege to be here, and I also want to thank Catherine Littler for inviting me. I'm the one with the general 5 minutes talk, and I also have slides, so I hope this is going to work. It's very exciting for me to see that all of the people who are coming in are from all over the world. So good morning, good afternoon, good evening, wherever you are. So I think I was invited because I'm the coordinator, like Mike said, of the Trust project, and one of our aims was to build trust in research in situations of extreme power differentials and resource differentials. We did so from the start, the trust building, by having a majority of team leaders from lower and middle income countries and a majority of female team leaders. And we also had two communities from Kenya and South Africa involved from the start who gave input on exploitation risks. We spent 1.5 years of trying to find the exploitation risks that lead to mistrust in international research. We found 88, and then we analyzed how they map onto ethical values. And all of them mapped onto fairness, respect, care, and honesty. And it was important to us to use values that are understandable to everybody. Shortly after the launch, this framework, this moral framework around these 4 values took off globally. Many countries are using it, and here you can see it just 2 weeks after its launch on the Al Jazeera channel when they talked about indigenous rights. Somebody asked prior to this seminar that we should put publications into our slides. So here are 2 short open access books. You can also email me afterwards if you want. But we are here today to talk about trust and trustworthiness in the context of pandemics. And one of the questions was, what is the difference between the two? And the easiest for me is that trust is given, whereas trustworthiness needs to be earned. So the 3 people on the right can be public health authorities or governments, and they need to earn trust, whereas the population can give trust to them. And I think one of the things that is happening and has been happening for years is that a lot of research is put into trust. How can we, through community engagement and various other exercises, increase the levels of trust? It doesn't happen so often that the trustworthiness is examined. And the question that was also posed for this seminar is, what are the key things that need to happen to strengthen trust? And for me, this is a stronger focus on trustworthiness. And this is where the 4 values could potentially come in, for instance, because they are not just ethical values, they are also personal characteristics. So you can assess whether a person acts with fairness, respect, care, and honesty, or whether they act out of self-interest, whether they're manipulative, hypocritical, or dishonest, which would be the opposite. This can happen at the country level. We've had an interesting question from the start about increased distrust between countries during the pandemic. Here, it's also possible to assess, do the relationships show fairness, the respect, care, and honesty? But the main problem with going at it from this different length, at looking at personal characteristics, is that it requires an awful lot of courage to point out when leaders, for instance, are acting out of manipulation, self-interest, etc. So my suggestion for this group is that there could be a closer collaboration between ethicists and psychologists, and then to home in on particular topics. So for instance, manipulation in social media as one effort that hampers COVID-19 efforts from public health authorities. So these were my 5 minutes, and I'm looking forward to any questions if there are, and I'll stop sharing now.
Thanks very much, Doris. That's really helpful. So now, without further ado, I'd like to introduce our second speaker, who is Dr. Lauren Paramour, who is a senior lecturer at the University of Cape Town and a member of PHM South Africa. Her research focuses on health activism, global governance for health, and political mobilization aimed at realizing social citizenship in societies of the global south. She's explored these themes in relation to the struggle for the right to HIV/AIDS treatment in South Africa, the social reproductive work undertaken by community health workers and women more generally, and the use of for-profit markets and philanthrocapitalism to ameliorate the worst effects of deteriorating public health systems. So welcome, Lauren. I'll hand over to you now.
Thanks, Michael, and thanks to the hosts for inviting me. It's a pleasure to be here. As you probably suspect from my bio, I'm not trained as an ethicist or bioethicist. I'm trained as a political scientist, and so this is what informs my remarks today. I won't be using any PowerPoint slides, but I hope that nonetheless I speak slowly and clearly enough and coherently enough for people to follow. So I want to start with one of the concepts that Michael mentioned, which is this idea of social citizenship. And I work a lot with it because I think it captures the idea that the state has an obligation to realize the welfare of citizens. So that would include health, but also welfare on other dimensions. So rights to education, to a basic income, and so forth. And so I think this idea of trust, really, we need to ask trust to what end? And for me, one of the central functions of the state is trust to realize the rights of social citizenship, to realize a society that's inclusive, not just in terms of political processes, but also in terms of a baseline of material welfare. So that's the first thing that I want to point out in relation to trust. So I think the second thing then to think about is that states are positioned differently in the global political economy in terms of their ability to realize this obligation. And so one of the things that I would like to propose today is that quite often, or historically, low and middle income countries, also called developing states, have struggled to realize the rights of social citizenship. And one of the key drivers of this has been their lack of access to public monies, public resources in order to deliver on these promises of social inclusion. If we take the long view, there are political scientists, Jean-François Bayard, for example, that locate this lack in historical dynamics, particularly colonial dynamics, that lead to what's called states that have an extroverted quality. They are extroverted in the sense that their incorporation in the global economy is one which develops local economies that are designed to serve the needs of global markets. And so I would argue that the long history of this problem of incorporation into the global political economy has led developing states perhaps to focus more on extractivist modes of production, certainly to prioritize their foreign obligations, perhaps more so than their social rights obligations towards citizens. The dynamics that the legacies of these colonial histories have been intensified, I would argue, by neoliberal globalization. And perhaps even I would propose that neoliberal globalization has increased the extroverted quality of states, even in the global north or in the developed countries. And so I think one of the things that's important about this in the context of COVID is that citizens have an experience of the state as perhaps having abandoned them and perhaps having abandoned prioritization of their well-being in the service of growing the economy and of serving the needs of global capital. And so I think on a concrete level, that's reflected, for example, in disinvestment of health systems, particularly public health systems, and increasing privatization and commercialization of care. And I think this is one of the structural features that led to so many difficulties in accessing medical treatment during the COVID pandemic. And this was a dynamic that we saw both in the global north and the global south. So I think this is one of the features perhaps that led to decline in trust in governance institutions in responding to the COVID-19 pandemic. Then I would argue that in terms of low and middle income countries in particular, that problems with trust perhaps are not necessarily only with the state, but with this global political economy that citizens recognize their states being located in. So I think, two concrete examples of this. In South Africa, where I'm based, our scientists have done excellent surveillance on COVID-19 mutations. And in November of last year, they identified the Omicron variant. They were transparent in communicating the fact that this variant had been detected and then it was highly contagious. But because of how South Africa is positioned in the global political economy, the blowback that came from that was a series of border closures and pariah status really for South Africa and other Southern African countries, including Botswana, that were stigmatized as being vectors of the Omicron variant. Another example would be COVAX. There have been numerous complaints about donations through COVAX of almost or near expired vaccines. And the problem this presents for states in low and middle income countries is that they then have to plan at very short notice complex supply chains, how to get the vaccines to the public, and also how to convince the public to take vaccines that they perhaps rightly regard somewhat with suspicion, given the fact that they're near expiration date. And so I think also when we think of trust, we should not only think of trust in our quote unquote governments, domestic governments, so trust vis-a-vis citizens and governments, but also the fact that I think specifically in developing states, citizens' suspicions of the state is mediated by I think a quite realistic assessment of the ways in which state power is curtailed by these broader global dynamics, and even where there is a sincere obligation on the part of the state to act ethically and to protect their social citizenship rights, like the right of equitable access to vaccines in this case, that capability is circumscribed by the broader political economy in which these states are located in. So I'll leave it at that and then hand back to the chair. Thanks.
Thank you very much, Lauren. So many interesting issues there. Please do remember, if you've got questions for our panel, please do type them into the Q&A so that I can pick up on those afterwards. But now I'd like to move on to our third panelist. I'm very grateful to him stepping in at the last minute to do this, and this is Ethan Greenwood, who's a project manager and senior data analyst with the Wellcome Global Monitor at the Wellcome Trust in the UK. So Ethan, hand over to you now.
Thank you, Mike. That's great. So my main role at Wellcome has been to look after the Wellcome Global Monitor, which is the largest global survey of attitudes to science and health. And what I want to talk about today was our last Global Monitor that was done in 2020. And this was done at the time, and it's important, I think, to emphasize the context of the pandemic had just began in March. So this was around the beginning of some of those kind of first lockdowns. And the key findings, I think, that were really interesting is that despite the pandemic, trust in scientists across the world did increase, and it increased in every region in the world, except for sub-Saharan Africa and Russia, Caucasus, and Central Asia. And trust generally increased in all types of institutions, it increased in doctors, increased in governments. The only place where trust went down was in neighbours, journalists was around the same. So what's really interesting is why is it that this happened? And we didn't come up with one very specific theory, but one explanation might be is this idea of rally around the flag, that people were in this kind of crisis situation. They kind of perhaps had no choice but to trust those institutions, trust what people were telling them. I think there's also a kind of nuanced story here, is that we also asked people about who they trust in terms of making decisions about COVID. Doctors and nurses were forefront, and then the World Health Organization, interestingly, and then after that, government. But despite the high trust in scientists, what we also saw is only a quarter of people felt that their government valued scientific advice a lot. And if you look at those countries where people were distrustful, they also aligned to the kind of visible face of the pandemic. So if you remember back in 2020, certainly in the UK, a lot of the news was around what was happening in Italy and the crisis in the hospitals. And we see there, that amongst Italians, about 2/5 said that their governments didn't value scientific advice. And we also see that in terms of confidence and trust. One thing I want to move on to very quickly is not just trust in science, but trust in what science creates. And I'm particularly thinking about trust in vaccines. We asked a question about COVID vaccines in 2020, but it was quite early on. And I think the one where we covered it much more was in our 2018 survey. And what we found is trust in vaccines is very much linked to trust in scientists. But I don't think it's a black and white issue. We saw, for instance, in France, where trust in scientists is high, distrust of vaccines is also quite low. But the correlation generally does stand. In low-income countries where trust tends to be high, whether you trust in vaccines didn't make much difference. But what's really interesting is that if you had high trust in science in high-income countries, about 82% thought vaccines were safe. But that goes down to about 48% amongst those who distrust science in terms of their vaccine safety. In terms of what from our research could be done to strengthen trust, I think if there's one thing that is really important to emphasize, and hopefully it touches on some of the issues that previous speakers have mentioned, is the real importance of scientists listening and understanding the public and what their needs are. And also how trust in amongst the public really does vary within countries. So one really interesting statistic from the 2020 Global Monitor is that in about 80% of countries where people said that they were living comfortably, they were more likely to trust scientists than those who said they were getting by or struggling. So there was a real difference there within society. Again, what previous colleagues were saying to talk about the issue of trustworthiness. And this is also partly a report that is worth looking at about building trust within communities that was prepared by the Red Cross and UNICEF. Really important in terms of being transparent and accountable, acting in people's best interests without regard to specific political views, being perceived as being competent and reliable. And governments really explaining about what they're doing and consistent communication. But I think my main message really from this talk is that it's not so much about the public having to trust scientists more, it's about the scientists understanding the public appropriately so they can build trust. Thank you for your time. Cheers.
Great, thanks very much, Ethan. But I know you need to go at past, but I got one question for you in the Q&A already, which is, could you say anything more about the why you think in France there was high trust in science but low trust in the products of science?
So I think the issue about trust, what we find generally is trust across Western societies is higher than low to middle income countries. Again, that might be to do with the presence of science and scientific institutions. I think there are many explanations for this. I can't say definitively, so this is very anecdotally, but perhaps in France, it might have been around a culture of skepticism within French society that treats everything skeptical and therefore skeptical towards vaccines. There may have been issues around misinformation and disinformation. We haven't really studied that, but that might be some of the issues that were going on. I haven't looked at how much attitudes towards vaccines changed in France in 2020. That might be a totally different issue, but that's generally what we found. Is we found pockets of countries where there was distrust of vaccines.
Brilliant. Thanks very much. So I've got a few questions now, but please do add more in the Q&A if you have them. I've got one which Doris mentioned earlier, which was someone's asked about within the context of COVID whether there's anything you could say about issues relating to trust between high income and low income countries, and sort of the fragility of that and the extent to which whether possibly the pandemic has amplified that in any way. So I don't know if anyone, Ethan, if you want to go first, given you've got like 2 minutes left, you'd be more than welcome, or I could.
Well, I guess the only point I would say is that really interesting point is that in Africa, for instance, sub-Saharan Africa, trust, which was low, did go down, and that was the exception. In most places it went up. So I think that's a really important context about why that might be in terms of the pandemic management, etc.
Brilliant. Thanks very much for joining us, Ethan. So Lauren or Doris, would you like to say something about that? Lauren.
Lauren, do you want to go first, or shall I?
Sure, I can go and hopefully keep it short. So on the question on trust between low and high income countries, I think perhaps there is a lack of trust, I would propose, because of several factors, both historical and contemporary. I think, for example, low-income countries have historically been quite active in terms of drug trials, but participating in drug trials, testing new medicines. This is, I speak about South Africa because it's the case I know best. So we've participated, I think, in drug trials for 3 different vaccine candidates. And that hasn't necessarily in LMICs translated into equitable access to vaccines. So I think this is one source of mistrust or tension. And then I think, specifically in the context of COVID, another source of mistrust has been, I think, the failure of COVAX, which was conceptualized as a central procurement mechanism to ensure equitable access for frontline workers and most vulnerable populations. And this was completely circumvented by high-income states pre-purchasing vaccine stocks and crowding low-income states out of the market. And so I think there is a sense that the multilateral system, even though the normative orientation of that system is supposed to be the enforcement of human rights everywhere for everyone, shakes out in practice as perhaps a reflection of existing hierarchies in power and law.
Thanks. Doris.
I think it's vaccine trials that have a major potential for groups feeling exploited. When we did the research on trust, there was a case study on an Ebola vaccine, which was meant to be tested in West Africa, and this was abandoned. Whereas in Canada, people queued in order to be part of this Ebola vaccine trial, in order to show altruism. And what we came to find in our research is that it's completely different. And that's also what Ethan said. If you are in a safe environment and you're taking part in a clinical trial in a hospital, your welfare and your well-being is secure, or if you feel you're a guinea pig for other people who need this vaccine. And this came through again at the beginning of the COVID-19 pandemic, especially with this infamous video with the 2 French doctors, which you may all remember. And the weirdest thing was that they talked about COVID COVID-19 treatments. They didn't even talk about vaccines, but this completely bombed, which showed the distrust issues. So it's not surprising that this got worse, in my view.
Great, thanks very much. So I have a few questions coming in from different routes at the moment, but one that I think maybe will be for you in the first instance, Lauren, but actually it'd be great to hear your view as well, Doris. So the question is, you gave a great articulation of some of the issues with trust from a political science perspective. Given the historical context and the pre-existing geopolitical and structural issues, the ones you mentioned, what are some of the steps we as a global health community should be focusing on in our efforts to work to build trustworthiness, legitimate, genuine trustworthiness, I suppose?
So I think, my instinct is to give an answer that might not sit well with health experts, and which is to say that we need to look at the social determinants of health, and it can't only be about the health system as such. I think, for example, one of the big issues that will confront developing states in the next few months and years probably is the issue of indebtedness and having taken on higher debt burdens as a result of the pandemic. And they will be pressured to repay that debt. There is already a pressure to implement austerity politics, and that has had regressive effects on health budgets and public health systems in particular. So I think one of the key focus areas, if we want to protect health, is to defend public health systems and also to advocate against debt recovery policies that will jeopardize that. I think also this pushing back on austerity politics will impact other factors like access to food, education, and housing, which are integral to promoting health in the broadest sense of that word. So for me, I think the key focus is on protecting social determinants of health.
So that's quite a big kind of issue, isn't it? So does that mean that in the meantime, clearly we all want that to happen. In the meantime, is there nothing much is trust essentially a sort of or mistrust maybe a product of these kind of social and political and economic inequalities? Is that what you're saying? I think that's what you're saying, isn't
it? I think mistrust is one effect of these broader inequalities. I think it's also a response to a history of these patterns playing out over time. So, I think the most obvious example is the fact that the continent, the levels of access to COVID-19 vaccination are vastly lower than anywhere else in the world. And even given this, I think, quite frankly, embarrassing differential in vaccination rates, there's no support, for example, for a TRIPS waiver, which is something that we could have done within months of it being requested in October 2020. So there are broader patterns. There are also intermediate political actions that could have been taken. Even in the absence of a TRIPS waiver, there could have been a greater effort to support the CTAP intervention and also the WHO mRNA technology transfer hub. And what we've seen is that this hasn't happened. So these are not modest asks, but they are, I think, more short-term asks. And it's simply not happening. So I think there's a lack of trust because perhaps there's a lack of global solidarity despite the many declarations to the converse.
Thank you very much. Doris, you want to comment on that question?
I agree with Lauren wholeheartedly that the bigger picture solution, social determinants of health in this case, need to feature in answers. But I also understand, Mike, why you are asking, so do we have to achieve this before anything happens, or can we achieve smaller things? But it's exactly the same thing in trying to establish equitable research partnerships between the North and the South, because if there are individual researchers who deal with integrity in research relationships, it is possible to build up these smaller pockets, the smaller solutions, as Mike, you would perhaps call them, but short of the bigger picture of proper equity in research relationships, the trust that is built on these small pockets can collapse very easily. So in the long run, whilst there may be, through example setting, for instance, ways of moving towards the bigger goal, I think it's very important, like Lauren also said, to keep this bigger goal in view.
Great, thank you very much. So I've got a different question, a couple of different questions now. So the first one is in relation to how these questions of trust and trustworthiness might relate to the collection and sharing of personal health information for public health. So the question is, would you care to comment on trust issues in the context of the collection of personal health information for public health purposes? They mentioned they say not just COVID, but let's focus on COVID for the purposes here. It would be helpful to map the general concerns you think are relevant in relation to the stewardship of data and trust. So I don't know, Doris, do you want to go first with this one?
I could, but we also have Jantina de Vries here, who is fantastic. I don't know whether it's possible to put somebody else on. She is a fantastic person on these data issues, but I'd be happy to have a go if it's not possible to.
Yeah, let's stick with the panel for now, because I think it might be complicated to do that.
Yeah. So,
I agree, Jantina. It's fantastic though, but yeah.
So there are the two issues. If there is cross-border exchange of personal data, it gets a lot more complicated. But within the COVID-19 pandemic, it's mostly national access to personal data, which in countries, according to my information, that have high levels of trust. For instance, I'm German. And the personal data uproar about all the personal data that is currently required by health authorities was comparatively low in comparison to what it was like in the UK, where I work. So I've got this comparison. The trust building is therefore also relevant, as it allows for a higher level of personal data handing over to health authorities. But the same privacy issues that apply anywhere, especially if it's health data that is required, obtain here as well. So when you say you want us to list the issues, I think they're very, very obvious. It's sensitive personal data, health data that are potentially available to people outside of the system. And that's a major infringement on privacy.
Lauren, any thoughts on that?
So I'm not an expert on data stewardship, but I can maybe pivot and think of the question from a different angle, which is, I think one of the things we've seen in the context of COVID-19 is hesitancy around sharing personal data as it relates to migration status. And so I think this is one of the things to think about in terms of the efficacy of vaccination efforts, but also other public health interventions, which is that where people don't feel protected by the state, and in fact, the state is perceived as being hostile to their well-being, public health efforts are very difficult to implement in a universalistic manner, even if this is the intention. So maybe that's one way to answer a question about the kinds of precarities that come with sharing personal data, even if it's for your medical benefit.
Right. Thanks very much. So moving to a different topic now, I've got a couple of people have been asking about the relationship between the sense of being vulnerable and trust, so vulnerability and trust. So one person is asking, is there a connection between those two things, and how should we understand that? And is there anything we can do about it? But more broadly, thinking about beyond individuals, vulnerability in relation to populations and groups. So whether it's obviously in the context of COVID. So what can be said about the relationship between vulnerability and trust or trustworthiness? Who would like to take that one?
Shall I go first?
Yeah. Okay.
So vulnerability can be understood in many ways, but two ways is vulnerability to harm and vulnerability to exploitation. And it's fairly obvious that if you suffer from those two, there you will have a higher level of mistrust, especially vis-a-vis the groups that are potential exploiters or that are potentially harming you. So it may be that you're vulnerable to to infection more than other people, which might not be such a problematic issue in terms of your relationship with public health authorities. But generally, just guessing here, I would say that the two people who posted this comment are right. If you're in a vulnerable position, you're more likely to have experienced past injustices, for instance, and therefore more likely to be mistrustful for good reason.
Lauren.
Yes, so I agree wholeheartedly with what Doris has said, and maybe to emphasize that where there are vulnerable populations, I think what has worked best, if I think of pandemics like HIV/AIDS, but also Ebola, is to work with allies, trusted allies within those populations. So in other words, that the relationship needs to be mediated, not through necessarily an impartial government bureaucracy, which may not be trusted for historical reasons, but through local community health workers, religious officials, civil society organization leaders in those communities. And I think definitely in terms of the COVID-19 vaccine rollout in South Africa, that's one of the interventions that's been successful in increasing uptake.
Thanks. I mean, one of the questions, there's been a number of questions about vaccination and sort of vaccine hesitancy. And I suppose one question is a factual one, which is to what extent do you think trust, the lack of trust, is a factor in low vaccine uptake where that's an issue? Or to what extent do you think it's other things, that trust here is a red herring, as it were? So I don't know if you've got anything you want to say specifically about trust in relation to vaccination. One person's asked specifically about children and vaccination, but more broadly, do you have any thoughts on that, Doris? Sorry, trying to bring together a number of different questions that are really comments rather than questions, but it'd be good to hear your thoughts on it.
Yeah. I'm not an expert, as I'm not an expert on data protection, but for me, what came through the literature that I did look at is the strong element of fear. And I looked at this literature in the context, because I'm co-writing a book on artificial intelligence and manipulation through the social media. And there it is very clear that fear as perpetuated through social media is a major factor in vaccine hesitancy. And public health authorities, there was another question, what can public health authorities do if the governments are not respected? They could perhaps tackle this fear and the ways of the distribution of this fear amongst broader populations.
I mean, so I would add that I think one of the other things that would increase trust in relation to vaccination is trust in the ability to access follow-up care. I think sometimes the question of hesitancy is not necessarily so much restrained to doubts or questions about the vaccine, but it's coupled to doubts about people's ability to access the health services they need if they feel like they're having an adverse reaction. And I think those concerns surface particularly in countries where people are managing a number of comorbidities. So, if you are HIV positive, if you're hypertensive, if you have diabetes, TB, people are well aware of the fact that vaccination will help you manage COVID better along with these comorbidities. But I think there's a reasonable anxiety around what happens if you don't tolerate the vaccine well and you've, for example, defaulted on your treatment because of an inability to access the public health system due to COVID-19 lockdown restrictions, overburdening the healthcare system and so forth. So I think hesitancy is often a reflection not only of doubts about the vaccine, but also about the reliability of being able to access the bigger health system.
Thanks very much. Apologies to you, those who are asking me where I'm getting the questions from. I'm trying to get them. People are putting them both in the Q&A and the chat, and I'm trying to keep an eye on both to make sure, because I'm not missing them all. But that's what's happening. So I've had an interesting question, which I think shifts the debate in a kind of interesting way, which is to do with thinking about the responsibilities of politicians per se. So thinking, we've sort of talked a bit as if it's sort of governments and institutions and establishments and their relationship with the public that's an issue, and we've talked a bit about that. What we haven't talked as much about is the responsibilities of those who make policy in relation to the way they conduct themselves. So one of the questions has been about the ways in which opposition parties, for example, will sometimes call upon arguments that with the example here is being, calling upon right-wing extremist kind of positions. But nonetheless, this question about how you have a living parliamentary democracy and debate, and at the same time be responsible as politicians in the context of an emergency. Just wonder if you have any thoughts on that, the responsibilities of politicians. Lauren, maybe you're the person to start with on this, given that it's your kind of home discipline.
So I think in a situation that is defined by uncertainty, which certainly this pandemic has been defined by, the primary obligation of political decision makers, politicians, is to be transparent in sharing as much information as possible, to be transparent about the ways in which that information shifts or changes over time, and to communicate that clearly and simply. I think related to this, there's an obligation to share all discussions surrounding policy decisions. So quite often governments will have advisory committees, special advisory committees on COVID-19. I think to the extent that happens, all of those discussions need to be made public, and there needs to be robust debate. And I say that because one possible source of mistrust in the context of a virus that's unknown is the fact that information keeps changing, right? And so some people might read that as a delegitimation of science, but I think politicians of wherever they sit on the political spectrum have an ethical and in fact a legal obligation to share information that's the most reliable, and certainly to be transparent about how that's informed policy making.
Yeah, Doris.
The reason why I put courage into my presentation is that I think today, especially in countries where the trustworthiness of the government is fairly low, it requires a lot of courage for other politicians to do something. So even just to give an example from a few days ago, when the British government said that the Irish policy of letting everybody from Ukraine in is a security risk for the UK, and almost nobody answered anything from this until a Tory politician came forward and said that's not an answer with integrity. So I think even in Britain, it requires a lot of courage, in my view, currently, to stand up for unpopular positions. And this will be the same in the COVID-19 pandemic. And what I think is required is to broaden the scope of the people with the responsibility. For instance, in Germany, 250,000 people went, in my home city of Cologne, went into the streets 2 weeks ago with solidarity for Ukraine, and they were wearing masks, so showing the trust in we still mask wearing, but this gives signs to politicians to step out, potentially out of their comfort zone. In the UK, for instance, somebody was killed because they were a politician, a member of parliament, who was against Brexit. So I think this courage really needs to be generated somehow.
Yeah, that seems important. Okay, I've got a couple of questions I'd like to ask before we finish. Maybe we'll have more time for others. But one is coming back to the point that we made earlier, or the comment I made earlier to you, Lauren, which was that, to what extent should we understand trust and trustworthiness in these structural kind of terms? Someone's asked, basically understanding that, but saying, what is it that we can do, if anything? How can we operationalize reducing reducing lack of trust or reducing fear in the context where there may not be much we can do in the short term about those issues? And what sort of things can be done, if anything?
Shall I have a go? Just something very quick. I think in every setting, it is possible for individual people to stand up with integrity for what they believe in, and then there will be a following. And especially in the context of COVID and trust, for instance, scientists, even if they're not heard by the government, they can do a lot to increase trust. But it requires a lot of sense of integrity to do so. But that's one possibility, that even a few people could make a difference.
So it's a complicated question for me, because I feel like it's very difficult to give an answer, and anything I can think of feels very non-specific. But given that, I think one of the ways to think about it perhaps is about the question of where do reservoirs of trust already exist. So I think, one of the things we can do is to build on those existing reservoirs of trust, and also to think about how they complicate our assumptions about, for example, COVID-19 containment. So, for example, the issue of physical distancing. We know that this is one of the key strategies to contain the spread of COVID. We also know that in many countries where the state has abandoned citizens, communities, family members, extended kinship networks are the ones that are trusted to provide aid in times of crisis. And so those are reservoirs of trust that exist in society, largely because that's how people have sustained themselves historically in the presence of a state that's absent in caring for their well-being. And so I think one of the ways to think about the pandemic is, how do you build on those reservoirs of trust and not stigmatize people that are seen to, I think on the simplistic view, are seen to transgress COVID-19 containment measures? How do you instead figure out local modes of managing COVID, caring for COVID-19 patients, and then build a bridge to the formal healthcare system?
Can you say, that's I find that really interesting. So when you talk about reservoirs of trust, it'd be nice for me at least if you could expand a bit on that. Do you mean sort of things like, existing, for example, networks that might be trusted, say, community leaders, or what? Do you want to expand a bit on what you mean by a reservoir of trust, so I understand what you mean by that?
Like, I think congregations, churches. Sometimes I think if you have a kind of savings club, they call different things in different places, but a kind of community association that comes together to do a rotational savings scheme. Extended family that lives in the same neighborhood, where people move between households to take care of children. So these kinds of modes of mutualization of a risk that are not through formal insurance schemes or through the state. And I think those bonds of reciprocity are really important, because there are great levels of trust. I think it also sometimes translates into behaviors that go against COVID-19 protocols. So, for example, in a community monitoring project here in South Africa, someone said, well, when you're amongst trusted family members, for example, people do take off their masks, because this is seen as a signal of trust and intimacy. And they know that there's a risk associated with it, but there's also a signaling of I guess, we're in it together, to use an informal phrase. And so I think I'm not advocating against physical distancing or masking. I think they're really important, but I think we do need to think about how they articulate with the ways in which people care for one another in the absence of the state doing.
Thanks very much. One question I'd be interested to know your thoughts about. So, one of the distinctions that social scientists often make is between trust and confidence. So the idea that, I may not I may trust my doctor to look after my data, for example, but have no confidence in the people behind the scenes and the rules that actually, my trust in her may be irrelevant because other people are going to do other things. Or the opposite, I may have no trust in my doctor, but I may have loads of confidence that structures are in place to protect me. I just wonder whether a provocative response in this kind of context might be to say something like, trust is not what matters. What matters is that there are rules in place and that those are strictly kind of adhered to, and that, as you say, there's genuine fairness in the way in which people are treated. So what does trust add over and above that sort of commitment to, let's say, equality or efficiency or whatever? What is it that trust brings to that confidence doesn't offer? I don't know, Doris, do you have anything to say about that?
Yeah, what I would say is that rules and processes are extremely time and resource intensive, so they couldn't be set up in any setting anyway. And then to achieve compliance with rules is also very time and cost intensive. So if you instead are able to have a feeling of trust between actors, it's going to be much more likely that you can do so and save money for much more important things like lifting up health situations or financing health systems better. So that would be a very pragmatic response.
Okay, thanks. Do you have anything you want to add to that, Lauren?
I mean, I think also just to signal that rules are fine, but again, to emphasize that COVID has brought so many uncertainties into play. And so perhaps in a context where we're not sure how the rules apply best, that there is something to be said for trust.
Great, thanks. Okay, so in the last few minutes, I've got one person has raised the issue of solidarity, so I'd be interested to hear on your views on the importance of that. But I'd also like you to say something about whether you think, in these kind of contexts, the COVID or other emergencies, whether you think, what are the responsibilities of academics like us, people in our kinds of roles? Do we have a special role to play in this kind of situation? So I say we've got 4 or 5 minutes left, but I don't know, Doris, do you want to go first? So sort of for any comment on relationship between solidarity and trust, and then secondly, kind of about us, what our responsibilities are.
Yeah, so the solidarity, I believe, is the value that is missing from our 4 values framework in the context of COVID-19, because it is the value that is promoted by those organizations, for instance, the Wellcome Trust, that are trying to push a vaccine rollout globally. And I think it is, as an ethicist, I think it is my responsibility to push this as far as I can. This value.
Sorry, any thoughts on how you might do that? How we might do that?
For me personally, I can answer because I've gotten a new program funded from the European Commission to develop the COVID pandemic ethics framework. And so I will spend 3 years from September on pushing solidarity through that.
Great. Okay, great. So Lauren, thoughts about solidarity, and secondly about, what are the responsibilities of political scientists in this kind of space?
So I mean, I think solidarity is important because I think of this definition that Samora Machel used that I quite like, which is that solidarity is mutual aid between people that are differently positioned but struggling for the same goal. And I think that's important because that idea of the same goal gives a common normative reference point. I think that does matter. I think trust can be a mode of interaction, but there isn't necessarily a commitment towards the same long-term objective. And so for me, that endpoint is important if we're trying to achieve social justice. And also the acknowledgement that we are differently positioned, and that I think should be seen as a resource. I don't think we all need to be the same or want all of the same things. So this to me is how I think of solidarity in relation to trust. For political scientists, I think it's important to not only do the analysis, but do the politics, and so advocate for things like increased accountability and transparency. You mentioned at the beginning that I'm a member of People's Health Movement, so to do that not just as an individual, but collectively. And I think for universities more generally, we have an obligation to share. So there's a right to share in the benefits of scientific progress. It's a right recognized in international law. I think universities have an obligation to advance this right. And one of the ways in which they can do that is to commit to open IP. Because universities are part and parcel of developing things like medicines that promote the right to health, if they can be broadly accessed.
Great, thank you very much. And I suppose between you, one of the other things you've advocated for, I think, is an important role of the universities in relation to the humanities, particularly in addition to these other areas of university activity, a special role of humanities and social sciences, perhaps more broadly. Okay, great. Well, look, we've now just reached the hour. I'm really grateful to both our speakers, Dr. Lauren Paramour and Professor Doris Schroeder, and Ethan Greenwood, who's not with us, but thank you both very much for taking the time to be with us today. I found that a really interesting discussion, and I'm looking forward to looking at the recording so I can listen rather than to pay attention to all these questions popping up. But anyway, thank you very much, both of you, and thank you very much to our audience today. Thanks.
Thanks a lot, Mike. Bye-bye.
Thank you, Uncle.